A good day to everyone. I'd like to thank Prof. Tanuj and the APAO Organizing Committee for this kind invitation to speak. These are my financial disclosures. So when the talk topics were assigned and the title of my talk was first revealed, I received WhatsApp condolences from friends all over the world. One such message said, "Just seen the APAO debate program. iStent is the best mix against Tanuj. Bless you, it's gonna be tough." But then the debate motion is not that the iStent is the best mixed device, but that the iStent is one of the best mixed options for glaucoma. Not saying that it's the best, but one of the best. And I'm also not saying that the iStent is the best glaucoma surgery ever in the history of mankind, but that it is one of the best mixed options. To examine this statement in more detail, we must first look at the original definition of mix. Mix was first defined by these characteristics shown here, and indeed the iStent is the archetypal mixed device which meets all of these criteria. First, let's look at the safety profile. Multiple RCTs have shown that the safety profile of combined phaco with iStent is essentially the same as phaco alone. If you're an amazing surgeon like Prof. Tanuj, then trap complications may not be a major worry. But for the majority of surgeons, certainly the potential complications of traps would deter them from offering the surgery to mild to moderate glaucoma patients as a phaco plus procedure. iStents also have at least moderate efficacy. The US FDA pivotal trial showed that combined phaco with iStent inject was more effective in lowering the IOP and had a higher success rate compared with phaco alone. About 2/3 of eyes which underwent phaco with iStent were medication-free. This randomized controlled trial comparing the iStent inject with 2 glaucoma medications showed that the iStent inject was at least as effective as 2 meds in lowering the IOP. The iStent is easy to use and is inserted ab interno through a cornea incision, sparing the conjunctiva. The iStent inject is really easy to implant, and you can be quite proficient with just a few cases. And certainly, it is much simpler and quicker than trabeculectomy. And no one will argue that the iStent causes minimal trauma and patients recover as rapidly as they do from phacoemulsification. This is my last iStent inject patient. He has pseudoexfoliation with mild glaucoma and was on taflotan. He underwent combined phaco with iStent inject. His vision was 6/6 on the first post-op day. He could resume swimming by 3 weeks, and his IOP is now 14 on no medications. He's an artist and is so happy with his outcome that he gifted me with a few of his artworks. Yet, despite these success stories, why is the iStent sometimes unfairly accused of being minimally effective glaucoma surgery? I think the answer lies mostly with inappropriate patient selection, and I must emphasize that the iStent and other mixed devices are not meant to replace traps and tubes. MIGS should be targeted at mild to moderate glaucoma patients on 1 to 2 medications. In the past, there was an unmet need for a safe surgical procedure which can be offered to these patients to reduce their medication burden and improve their quality of life. In our BJO editorial, we highlighted that patient selection is crucial to the success of MIGS. Prof. Tanuj is not a fan of MIGS, and this may be because his patients may veer towards more advanced glaucoma, and I agree completely with him that in such a situation, the iStent would be generally ineffective. Mixed patients are entirely different from trap and tube patients. The iStent would do very well in the context of mild to moderate glaucoma, unmedicated IOP in the 20s, and a modest IOP target in mid to high teens. Though mixed devices can be considered costly, cost effectiveness is a much more complex issue. Many studies have reported that, contrary to popular opinion, iStents are actually cost-effective in many reimbursement environments, including Canada, New Zealand, and the United States of America. And this is because branded rather than generic glaucoma eye drops are prescribed in these countries, which are very costly. And in countries such as Colombia, in which patient compliance to medications are low, iStents have also been shown to be cost-effective as they may preserve vision. In summary, the iStent is the archetypal mixed device and meets all the defining characteristics of mix. It fulfills a previously unmet need in the glaucoma treatment algorithm and has also been shown to be cost-effective in many reimbursement environments. Hence, it is indisputable that the iStent is one of the best mixed options for glaucoma. Thank you very much for your attention.